The Kentucky Nurses Association has criticized President Donald Trump's Department of Education after the DOE removed nursing from its list of professional degrees.
It's been done with the goal of reducing the cost of graduate tuition by capping federal loan amounts.
Our Ian Hardwitt found Kentucky is still in need of thousands of advanced nurses, and he's here with more on that demand. Ian?
The Kentucky Nurses Board projects 2,300 nurse practitioner positions will need to be filled over the next 5 years in Kentucky. It requires a higher level of schooling, but nursing groups say the new limits on loans could discourage people from entering the field.
So this is Sublocade. It's a once-a-month injection for opioid dependence.
Trevor McGuffin treats addiction at Total Wellness Center in Elizabethtown. He's a recent nurse practitioner graduate from the University of Louisville.
Here in Hardin County, I have some patients that drive an hour or more to come see me because they do not have access to mental health care in their area.
McGuffin could take out federal loans for the whole cost of attending school. But now, President Donald Trump's Department of Education is reclassifying nursing as a non-professional degree program. That caps federal loans at $100,000 with the goal of forcing colleges to lower tuition prices.
Everybody in my practice also took out federal loans, and if I didn't have the access that I did to those loans, I would probably not be in this position today.
However, the Department of Education website says 95% of nursing students borrow below the limit, but doesn't clarify whether that includes undergraduates. The graduate nursing program for anesthesiology at the University of Louisville costs $115,744 for in-state tuition. That's over the new limit.
It's not cheap to get a graduate education.
Donna Metter, a previous president of the Kentucky Nurses Association, said those educations are needed statewide.
Especially like smaller rural hospitals that, don't have a 24-hour available anesthesiologist. And so those CRNAs are really valuable to help them keep their procedure workload going.
She added that nurse practitioners are the highest level caregivers in 46 Kentucky counties.
If the education costs don't come down, then what? Probably negative effects on our communities.
For McGuffin and Metter,
I felt very insulted.
The reclassification felt sudden.
You go from calling nurses healthcare heroes not too long ago, going into the hospitals, risking their lives and their families' lives, to considering us not a professional degree anymore.
But the Department of Education insists the label is merely meant for loan limits, not meant as an insult to the career.
You showed us anesthesiologists, such on the high end of the degree you would need to get. Is that why that one is so expensive, or are the rest of them that high?
Not all nursing degrees cost that much. When I did some research on it today, I was looking at somewhere between $80,000 to that $115,000 range. So some of these nursing degrees that are graduate degrees could still fall under that $100,000 loan limit. And the Department of Education says this would take effect sometime next July.